progress and leave us defenseless against infections that today can be treated easily. Although antibiotics are a key focus, antimicrobial resistance also includes resistance to medicines for HIV, malaria, neglected tropical diseases, and more. Wednesday marked the start of World Antimicrobial Awareness Week, an annual opportunity to raise awareness of antimicrobial resistance and encourage best practices among the general public, health workers, and policymakers to slow the development and spread of drug-resistant infections. The slogan for 2020 is "Antimicrobials Handle with Care." For years, WHO has been working with the Food and Agriculture Organization of the United Nations and the World Organization for Animal Health to address antimicrobial resistance and other health issues that arise from the interaction between humans and animals with a One Health approach. Our three organizations, called the Tripartite, conduct regular surveys to monitor country progress on antimicrobial resistance. Our latest report, with data from 136 countries, shows that almost 90% of countries have national action plans for antimicrobial resistance, but only 20% have identified funding for implementation. To help address that gap, together we have established a trust fund to support low and middle-income countries to develop a truly One Health approach to addressing antimicrobial resistance. Thanks to the governments of the Netherlands, Sweden, and the United Kingdom, to date we have raised $13 million, which will provide the first round of support to 11 countries. Just this week, we have launched the implementation in Indonesia. Additional funds will be required for the next round of investment. Today, the Tripartite is launching a new report that examines the international instruments that govern the use of antimicrobials and identifies gaps in regulations for use of antimicrobials in human, animals, and plants. Together, our three organizations will work to address these gaps and generate more global coherence in the use of antimicrobials. One of the most important ways to do that is through increased political commitment at the highest levels of government. That's why today we're launching the One Health Global Leaders Group, which will bring together prominent leaders from government, the private sector, and civil society organizations to advocate for urgent action to combat the threat of antimicrobial resistance. The group will be co-chaired by Her Excellency Sheikh Hasina, Prime Minister of Bangladesh, and Her Excellency Mia Mottley, Prime Minister of Barbados. The group will bring together key stakeholders in agriculture, health, development, food and feed production, and other relevant areas to maintain urgency, public support, political momentum, and visibility of the antimicrobial resistance challenge. It's now my great honor to introduce the co-chair of the One Health Leaders Group, Her Excellency Sheikh Hasina, the Prime Minister of Bangladesh, to say a few words. Your Excellency, you have the floor. And thank you so much for your commitment and support.
Thank you very much. Bismillahirrahmanirrahim. Her Excellency Mia Mottley, Honorable Prime Minister of Barbados, Directors General of World Health Organization, WHO, Food and Agriculture Organization, FAO, and World Organization for Animal Health, OIE. Excellencies, ladies and gentlemen, Assalamu alaikum and good afternoon to you all. I am happy to join the launching event of One Health Global Leaders Group on Antimicrobial Resistance as a co-chair. I would like to thank the important tripartite partners, WHO, World Health Organization, FAO, Food and Agriculture Organization, and OIE, World Organization for Animal Health, for their initiative to establish this group for coordinated action and collective global governance to address the serious challenge of the antimicrobial resistance. As the co-chair of this initiative, I look forward to working with my esteemed co-chair and the global leaders to combat the challenges for the health of people, animal, and for safe food and crop production and risk for the whole environment. Ladies and gentlemen, there is no doubt that antimicrobial resistance has become a global public health challenge, both for humans and animals. Endangering food production is leading us towards catastrophic results. We are running out of available antibiotics and soon could face another global emergency far severe than the current Covid-19 pandemic. This menace has the potential of rolling back most of our medical and therapeutic successes achieved through scientific advancements over the ages. Unnecessary use of antibiotics, wrong doses, and overall poor infection prevention are causing this grave situation. Inspired by the WHO Global Action Plan in 2015, we, Bangladesh, formulated the National Action Plan for Antimicrobial Resistance Containment 2017 to 2022. In Bangladesh, this document and its associated roadmap speak about our government's policy, thrust, and commitment to address AMR. This is an important component of our efforts to ensure universal health for all in our country. Now we need worldwide coordinated actions to monitor the nature of infections, to implement required control measures, and to raise global awareness against widespread use of antibiotics. We should also ensure affordable access to new antibiotics by all. For this, I also call for increased internationally coordinated investment for more research for inventing a new generation of antibiotics. Excellencies, prevention is better than cure. So, I would call upon the global leaders to make this timely initiative successful by providing advocacy, technical and financial support for effective implementation of the recommendations of the Interagency Coordination Group on Antimicrobial Resistance to address the global antimicrobial resistant crisis. I hope this leaders group will be successful to mainstream this vital health issue in all our important discourses, contributing to the united global effort to fight the ominous development of antibiotic resistance. I thank you all.
Thank you so much, Your Excellency, Prime Minister Hasina. I would now like to introduce the other co-chair of the One Health Leaders Group, Her Excellency Mia Mottley, Prime Minister of Barbados. Your Excellency, thank you for your commitment and support, and you have the floor.
Thank you very much, Director General Dr. Tedros Ghebreyesus, Your Excellency Sheikh Hasina, Prime Minister of Bangladesh, Dr. Kyu Dong-yu, Director General of the FAO, Dr. Monique Eloi, Director General of the World Organization for Animal Health, My government is honored to be asked to co-chair the One Health Global Leaders Group on this important area at a time when antimicrobial resistance has been identified as one of the signal threats to development over the next century. For us, there are too many, from the climate crisis to the pandemic to this, and therefore we've determined that we must face it head on. Antibiotics and similar drugs such as antifungals, antivirals, and antimalarials together, called the antimicrobial agents, have been used, as you said, for a while and have threatened now, if we don't get this correct, to reverse a century of medical progress. The systematic misuse and overuse of these drugs in human medicine and food production have contributed to this rise in antimicrobial resistance, or the ability of a microorganism to stop an antimicrobial from working against it. In simple language, for us, this threatens the effective prevention and treatment of an ever-increasing range of infections and is reducing our ability and the ability of health systems to protect vulnerable patients at the very time when we are more conscious of the need to protect all human beings as a result of this pandemic. AMR also reduces our capability to protect the health of animals and therefore also threatens safe and sustainable agriculture. We have become so dependent on the availability as needed of effective antibiotics to cover surgery and childbirth, as well as animal husbandry and other food production, that with increasing antimicrobial resistance, we face threats of the return to unsafe childbirth, increased illness and death with surgical procedures, re-emerging diseases such as tuberculosis, or threats to food security and food safety, as well as economic losses to countries, and I would like to suggest in our case in particular, with the multiple existential threats that small states face, developmental regression. All countries will be affected by this. Addressing it requires the acceptance that there must be an intersectoral issue that needs action across all sectors, since it has resulted from activities within both human and animal health, as well as in plant production. And this approach, therefore, by the three organizations is heartening. It requires a commitment to continued action within and across countries at all stages of development, from the very developed to the developing countries. The formation of this group, therefore, for advocacy and advising on best practice is clearly an acknowledgement of these realities. The goal of this group is to ensure that attention is kept on this important subject so that progress is shared. I must confess that at a personal level, I first learned about it a couple years ago through a documentary. And it just proves that we need to be able to speak to our people through multiple different media and not just from a scientific or government policy perspective. It is the awareness among our populations that will also place pressure on the systems to ensure that sufficient funds are invested in this area of research so as to ensure that we really do not reverse a century of medical progress. Like many other countries in the world, Barbados completed a 5-year national action plan to combat antimicrobial resistance using the One Health principles which shared the goals and objectives of the Global Action Plan on the same issue. Since then, the Multi-Sectoral Steering Committee has been conducting a stepwise implementation of the plan, starting with the strengthening of infection prevention measures after a health facility audit and an antibiotic stewardship in the Lone Public Tertiary Care Hospital in Barbados. The focus on infection prevention has served us well for the preparation of ourselves as we fight off this pandemic. We are also part of a South-South collaboration with the government of Argentina, the Pan American Health Organization, and the Caribbean Public Health Agency, started last year in 2019 to strengthen laboratory diagnosis of antibiotic resistance. Our experiences with implementation have served to highlight that education alone is not sufficient to change practice. At country level, testing infrastructure and materials, as well as trained personnel, are needed to identify gaps in best practice. Other resources are necessary to allow alternative ways of doing business, all of which are dependent on financing and partnership. The Prime Minister of Bangladesh made the point that we need to ensure equitable access for all across the globe. And we are even more sensitive to this reality given what we are facing with the pandemic. I hope that the world will find both the political will and the financial resources to encourage a multi-sectoral and multi-dimensional approach such that we can conquer this problem by putting sufficient resources behind the research necessary for us to move to the next level. There is a view that we have not put sufficient resources to advance progress on combating antimicrobial resistance. It is a view that Barbados shares. We are therefore committed to doing whatever we can, along with whoever we can, to achieve success in this struggle. For at a very personal level, almost all of us know people who have been victims of this antimicrobial resistance and of hospital-aided infections. It is up to us to ensure that we not only leave this problem behind us in the third decade of the 21st century, but that we also commit to ensuring that the vulnerable among states and the vulnerable among our citizens are not left behind as we fight this most grave of battles. I thank you.
Thank you so much, Your Excellency Prime Minister Motley. And I'm also very proud that my new granddaughter actually shares the same name with you, Mia. So I'm really proud, and thank you for your support and commitment. I'm also delighted to be joined today by my colleagues in the tripartite, Chu Dong-yu, Director General of the Food and Agriculture Organization of the United Nations, and Dr. Monique Elliott, Director General of the World Organization for Animal Health. Mr. Chu, welcome, and you have the floor.
Thank you. Thank you, my brother, and Your Excellencies, Prime Minister of Bangladesh and Barbados, ladies and gentlemen. I'm so happy to see all of you are safe and well. Taking this opportunity, I would like to thank my brother, Dr. Tedros, for the great leadership in combating the COVID-19 pandemic. Today, we are here to announce the establishment of the Global Leaders Group on the Antimicrobial Resistance, AMR. It is an important milestone of the AMR global agenda and will play the key role in global governance. The Global Leaders Group will have a catalytic impact and demonstrating the strong leadership and advance the response on AMR, which will sustain the political momentum and build the public support and resources mobilization at the regional and national levels. FAO is committed to work together with the WHO and OIE in tackling the AMR through the One Health approach. A new FAO action plan on AMR for 2021 to 2025 will be launched next year. This will consolidate FAO position to contribute to international efforts to combat AMR and to provide further support to government, producers, traders, and other stakeholders in adopting measures to minimize the use of antimicrobials and contain AMR. AMR is everyone's business. We are now in the middle of World Antimicrobials Awareness Week. FAO's theme for this week is AMR is here now and united to strengthen food system and secure livelihoods. A series of events are planned this week to increase the awareness and stakeholders' engagement. During the COVID-19 crisis, we must not forget that the AMR is a slow-motion pandemic with a significant long-term threat to the global public health and food security, which needs multi-stakeholders' engagement. If AMR is left unchecked, the next pandemic we face could be bacterial and much deadlier if the drugs needed to treat it do not work. AMR is here now, so we need to double our efforts and strengthen our partnership with all stakeholders, international organizations, private sector, and civil society, because only together can we achieve the one world, one health, and one planet we are living on. Thank you for your contribution and engagement and commitment. Over to you, Mr. Tedros.
Thank you, DG Chu. Thank you so much for your partnership and friendship. And now it's my honor to introduce the Director General of the World Organization for Animal Health, Dr. Monique Elliott. Monique, welcome, and you have the floor.
Thank you very much for your introduction, and thank you for giving me the floor. Excellency, ladies and gentlemen, good afternoon, good evening. As you know, while we are all experiencing the global crisis due to COVID-19, severely impacting our life and altering the livelihoods of million families, we also must remain vigilant to other looming global health threats, such as antimicrobial resistance. The good news, because we have a good news, is that we know how to tackle antimicrobial resistance to avoid this issue becoming the next global crisis. But we need to act together and act now. At the World Organization for Animal Health, we also strongly believe in the fundamental idea of the One Health concept, whereby the health of humans, animals, plants, and the environment are considered intrinsically linked, and where global health risks such as antimicrobial resistance need to be addressed through this lens from the outset. The tripartite, our three-way partnership between the FAO, the WHO, and Hawaii, and UNEP, which soon, has been collaborating for over a decade to combat this growing problem, committing resources and energy into targeted activities based on the One Health approach to prevent an AMR crisis to arise. Within the animal sector, for instance, the Hawaii continues to strengthen veterinary services governance through appropriate and updated legislation and regulations. And the tripartite international instruments publication to the WHO DG, as referred to a few minutes ago, is an additional tool for doing so. Excellencies, ladies and gentlemen, the tripartite is placed in a unique position to develop actions and strategy to solve the global issues of antimicrobial resistance. However, the newly created One Health Global Leaders Group will help us to accelerate our efforts forward. The today launching of this group is not a starting point, but an important additional new step to bring together the power from heads of state, public, civil society, foundations, academia, private sectors, of course, to reimagine governance and advocate for a common objective, namely the prudent and responsible use of antimicrobials. I would like to therefore warmly thank all the personalities who have accepted to be member, and in particular the two co-chairs, Her Excellency Sheikh Hasina, Prime Minister of Bangladesh, and Her Excellency Mia Mottley, Prime Minister of Barbados, who are with us today and apparently already very much engaged. Thank you for that. The tripartite will thus benefit from the strength of the One Health Global Leaders Group to strategically elevate the AMR issues, ensuring sustainable political momentum and support. So thanks to this One Health multi-sector approach, and together we will reconnect all the dots, ensuring humans, animals, plants, and environment are kept healthy and safe from AMR. Thank you very much for your attention.
Merci beaucoup, Dr. Elliott, and thank you so much for your partnership and friendship, and thank you also to all our guests and our leaders, Prime Minister Sheikh Hasina and Prime Minister Mottley, and my two colleagues. We look forward to working closely with all of you to protect the medicines that protect us. Thank you so much, and Fadila, back to you.
Thank you, Dr. Tedros. Just reminding journalists that we have a simultaneous interpretation in 6 UN official languages plus Portuguese and Hindi. I would like now to open the floor to questions from members of the media. I remind you that you will need to raise your hand under the raise your hand function in order to get in the queue and to ask questions and unmute yourself. Can I maybe make a suggestion to our friends from the media? If you can start raising your hand for question on AMR, because we have the opportunity to respond to your question from several experts and guests. So I would like really to take the first question about AMR, and then we will come to your question on COVID and other issues. I would like to invite the first journalist, Laurent Sierot from ATS, Swiss News Agency. Laurent, can you hear me?
I can, thank you, but actually it's not a question on AMR, so do you want me to wait?
Yes, Laurent, thank you. I will come back to you later on. A second journalist I have online is Carmen Pone from Politico. Carmen, can you hear me?
Yes, I can, Fadela. Thank you so much. My question is actually about AMR and coronavirus. I was wondering if all the cleaning that is happening now around the world of surfaces and, public transportation and all that kind of stuff, which I understand also uses, antimicrobial substances, is there any concern that that will contribute on the long term to a rise in antimicrobial resistance? Thank you.
Thank you, Carmen. I would like to invite Dr. Hanan Balkhi to take this question. Dr. Balkhi?
Yes, thank you very much. That's a very important question, and I think